Good morning. I hope all's well and that summer is going well and that the studying for the NPLEX is proceeding as it should, which is the reason for us sending you this file. As you know, a minimal amount of homeopathy is absolutely necessary to be able to pass the exam. To be more specific, there are different parts of the NPLEX exam, and since the test was reformatted, one of the sections contains homeopathy and botanical medicine. The two goals for this audio file is to have you receive as close to 100% on the homeopathy part as possible, but more importantly, to do it in a fast, efficient manner so that it affords you more time to spend on other parts, thereby hopefully getting a higher grade on the non-homeopathic side and more likely to pass the test. As such, I'd like to make a couple of brief initial comments. First, the information presented is solely designed for the test. It is by no means complete and, in fact, by no means accurate to the practice of homeopathy as presented in the classes that we've had together. However, the goal is passing the test, and towards that, I'm mirroring the errors made on the test with information that they want you to repeat. To put it another way, as we discuss the remedies, you'll become aware that what I'm describing here is both a caricature of the remedy, an incomplete version of the remedy, and in some instances, I think even an incorrect piece of information. However, oddly, sadly, that's exactly what needs to be reflected on the test. My goal here is to have you pass the test and receive your license. At some point in the future, I hope the test will be corrected, and then we could present a more accurate version of homeopathic practice. Finally, to orient you to this file, this audio file has several sections to it. Part 1 was this introduction. Part 2 is a brief discussion on homeopathic history, potency, follow-up assessments. Part 3, which is the majority of this audio file, is a presentation I gave in front of a class that, while it has a bit of history, it focuses primarily on materia medica that you should know for the test. Please note that the remedies described are written out in a Microsoft Word file accompanying this audio file. That's for spelling and just visual presentation. Regarding this third part, which is the most important part. As you know, we usually present the remedies in a full, complete fashion, with a great deal of cases exemplifying the use of the remedy. Often there's a great deal of humor in the description, storytelling, examples, things we've seen in the cases we've seen in the office, in children, adults, older adults, and even oldest old adults. Here, however, we're down to the basic, the most base information that is necessary for the test. Sorry about that. Take a break whenever you need to, pick up from where you left off, and really, if you had studied the small remedy file that we sent out in the second class, you should be in pretty good stead. But even if not, this should be enough to pass easily the homeopathic portion of the NPLEX. And I think with that, we should just pick up. Okay, this is the second section, just the sort of history and philosophy and how to. So homeopathy was developed by Samuel Hahnemann with his first accidental proving of cinchona in 1790, which he put in book form in the Organon of Medicine in 1810. The definition, I guess the sort of nicest one to use is the one that the FDA uses in their document, Conditions Under Which Homeopathic Drugs May Be Marketed. Homeopathy is defined as the practice of treating the syndromes and conditions which constitute disease with remedies that have produced similar syndromes and conditions in healthy subjects. In the Organon, there are several sections describing the philosophy and practice of homeopathy, so here goes. First, preparation of remedies. which is described also in the Pharmacopoeia, which in the United States, we have the Homeopathic Pharmacopoeia in the United States, describing how to prepare different remedy types. The three most common versions of potency preparation is the X or decimal process, where it's 1 part per 10, which creates a 1x. Then if you take one of those and you go 1 part per 10, that's a 2x. If you take 1 part of that and add it to create a 1 in 10 of that, it becomes a 3x, etc. Centesimal scale, or C scale, is 1 part in 100, which produces a 1C. 1 part of that in another 100 becomes diluted in another 100 becomes a 2C. 1 part of that diluted in another 100 becomes a 3C, etc. And the third method is LM potency, where it's 1 part per 50,000, which produces a 1 LM, and then he sort of moves up to a 2 LM, 3 LM, and so on. The process of preparation is always a kind of a dilution or trituration process if it's a solid. That's the first step, and then succussion or some sort of vigorous shaking as a second step. So it's not just dilution, it's dilution and succussion. And remedies are stored, labeled, stored, manufactured appropriately as in CGMP process. All right, onward. The way we understand what a remedy might treat is doing a test, which is called a proving, where you administer a substance to a healthy person and to establish what symptoms that substance might provoke in the healthy person. Essentially, we're talking about a phase 1 clinical trial. So, and for the purposes of this, for the NPLEX test, what we're talking about is just wanting to see which new symptoms develop, and those new symptoms will then enter into the materia medica. So, which is the sort of next section. Once all the symptoms are gathered and agreed upon, then those symptoms are written in a materia medica, which lists each remedy and the totality of symptoms that are produced by that remedy. Onward, case taking. Case taking involves logging in both the totality of the symptoms a patient has, separated primarily into general symptoms and particular symptoms, with general symptoms being mentals, emotionals, and all the symptoms that sort of are exemplifying the person in general. So, for example, they are warm, or they are chilly, or they have left-sided complaints or right-sided complaints. Those are generals, which are considered to be more important than particular symptoms, as in a particular symptom is as in my left foot or my right knee, and so on. So the process of case taking, as expressed by a homeopath called Boninghausen, involves several sections: the etiology, the location, the sensation, the modalities, and the concomitant symptoms. The concomitants are symptoms that develop at the same time as the symptom in question. For example, every time I have a migraine, I have diarrhea. The diarrhea is concomitant to the migraine. Modalities are symptoms that modify your main complaint. So, for example, I have a migraine when it's wet outside, rainy outside, humid outside. The humidity and rain are modalities that make things worse. And I feel better if I put a hot pack on my head. The hot pack is a modality that makes the migraine better. And lastly, keynotes are highly characteristic symptoms that might be strange, rare, peculiar, that are more likely to point to a small set of remedy potentials, and so are seen as being most valuable. Again, this is for the purposes of this NPLEX test. The reason the reason we're taking the case is to find the symptoms, and we're using the symptoms to find which substance has produced similar symptoms. In that way, we find the homeopathic remedy that might be called for, that being called the simillimum, which is the remedy that corresponds best to the patient's totality. Onward. In this process of case taking, one of the issues or one of the concepts that one should know is the concept of miasms, which for Hahnemann, he basically described two types of miasms in general. Ones are sort of acute infectious in nature, as in measles, pertussis, and so on, and more importantly, the chronic miasms. And he listed originally 3 chronic miasms, psora, psychosis, and syphilitic miasms, with psora being the most important miasm. And for him, miasms are a sort of a inherited or acquired predisposition or symptom development. So a psora is primarily functional disorders that lead to hyperreactivity, exemplified by lots of skin rashes that just don't do much except for itching. The psychotic miasm, which is exemplified by gonorrhea and diseases that lead to some sort of overgrowth, lumps and bumps. And the syphilitic miasm, exemplified by any disease that leads to a lot of destructive tendencies, including ulcerations and cancers that basically destroy the system. And I think there's a lot more to say, obviously, with all of this. We spent a whole weekend on it, but that's sort of the basic way to tell the difference. If the patient is more or less unchanged, except having this sort of reactivity, you're looking at a psoric remedy. If there's a lot of growth and infections and pus and like that, you're looking at psychotic miasm. And if there's a lot of destruction and blood escaping and hemorrhaging and tissue breakdown and bone breakdown, you're looking at the syphilitic miasm. All things being equal, the syphilitic miasm is worse than the psychotic miasm, and all things being equal, the psychotic miasm is worse than the psoric miasm. And over time, there have been other miasms that have been put forth, including the tubercular miasm, which combines the other 3 miasms, the cancer miasm combining the other miasms, and so on. But we'll skip that for now. All right, onward, repertorizing. The repertory is a book or an electronic program, or rather a database that lists an individual symptom and then all the homeopathic remedies that have either elicited or cured or somehow addressed that set of symptoms. So after case taking, it's very typical to then repertorize using a repertory, keeping in mind that for the purposes of this test, they may want you to say that the mental, emotional symptoms are more important than the physical generals, and the physical generals are more important than local particular symptoms. And so you'd be repertorizing preferentially. For the purposes of this test, dosage is considered, a low potency is considered something like a 6C, a mid potency is something like a 30C, and a high potency would be something like a 1M or a 1000. And generally, you'd be prescribing a low potency to weak people, to people that are experiencing a lot of interfering substances, or somehow you have the feeling that they're too sensitive or too hypersensitive for a high potency. People that you might give a high potency to are people that are vibrant or that have extreme symptoms with a lot of energy, with very sharp, precise, complete symptoms. So clear modalities. They're not doing anything that might interfere with the remedy. There isn't a lot of tissue change, gross pathology, so therefore there may not be aggravation. And that you're pretty clear about the remedy. Disease is acute, self-limiting, or chronic in nature. And therefore homeopathy can be used to treat acute or to treat chronic or constitutionally. And if you're treating acutely, you'd like the follow-up to be a few minutes to a few hours to a few days later. Whereas if you're treating somebody constitutionally or chronically, you'd like to do a follow-up within a month or two. The effect of the remedy, now this feels a little silly because we spent a whole weekend discussing this in a very precise fashion, but for the purposes of the NPLEX, the pieces that you should know are aggravations that many times, if the potency is too high, even with the correct remedy, they may experience an aggravation. An aggravation is where some symptoms get worse, some local symptoms get worse, and they're symptoms that they have already had. But even though some of the symptoms get worse, in general they feel better, and the sort of major chronic symptoms, the big complaints, are better. However, if somebody is experiencing an aggravation, and at the end of that aggravation, at the end of a month or two, they feel the same or worse, it's the wrong remedy. And lastly, if they've had a prolonged aggravation and they're back to the status quo, it may be an incurable case. That said, this is simply for the purposes of this test. We go much more detail in class. Suppression, meaning that the next thing, suppressions are when some symptoms go away and are replaced by worse symptoms. In other words, going opposite to Hering's law. This can happen with any intervention, and the best thing you can do is antidote the remedy, or antidote whatever the treatment is that has caused the suppression. That said, the suppression could be from botanical medicine, Chinese medicine, not just allopathic drugs. Antidoting is where you stop the effect of a remedy either on purpose or by accident, and the patient starts to slide back to where they began. Again, we're much more precise in class on this, and the best way to do that, is just with some sort of aromatic essential oil, or with a medication aimed at the symptoms that have gotten worse that you're trying to antidote. A disruption is when a case becomes disordered with the symptoms changing in a variety of ways, but the patient is more or less unchanged. This happens with the wrong remedy that's close. It happens with people prescribing a ton of different remedies. It happens with changing lots of remedies frequently. And there's ways to deal with that, but that's not going to be on this test. Palliation is where there's temporary relief of the complaint without a true cure occurring. Follow-ups. The topic of follow-ups, it's not clear to me how many questions will be here, but so I'm just generally gonna describe this. There's basically only 3 choices in follow-ups. You can either wait on the remedy, repeat the remedy, or change your remedy. And we talk a whole weekend on this topic, but this is for short. Wait if, in general, the patient is moving in the right direction, following the spirit of Hering's law in any sort of fashion. Even if it's moving slowly, you should still wait. Repeat the remedy. If they made improvements and the improvements start to go away, in other words, the patient is starting to relapse, and that the general state is the same. In other words, the general structure of the case is the same. Or if the case is somehow stuck, they made improvements and now they're stuck for a period of time, repeat. And lastly, if the structure of the case has changed, in other words, the mental, emotionals, physical generals, keynotes, if all those things have changed and they're not doing well, then that would be the time to change the remedy. All right, I think that's sort of the basic history and the sort of parts of the homeopathy that I think we might need to know before we get to the remedies. And so we'll go to the next last section, which is a description of the remedies. Okay, so I think what I'd like to talk about is just the whole breadth of homeopathy, all the bits and pieces, as if you're going to take a test. And for lack of a better terms and stuff, there's what I would consider real homeopathic care and knowledge, and then there's what most people do for homeopathy, which is sort of glancing over. It's enough to pass tests. It's not enough to practice in reality, but it is enough to sort of, get sort of like a broad stroke view of homeopathy. So homeopathy got started by Hahnemann, 1755 to 1843. In 1790, he took China and created what essentially became the first proving, which he then published in the Organon in 1810. The people in homeopathy that are sort of important to know is, besides Hahnemann, is Bonninghausen, who was a lawyer initially and then became a homeopath, who created a whole repertorization process called, the Bonninghausen method. A guy named Constantine Hering, which had many inventions, including writing materia medicas, teaching, creating new provings, giving us remedies like lachesis, and the thing that most people know about him is Hering's law, which is a cure progresses from above down, inside out, most important to least important, and from the most recent diseases to the most distant, the oldest diseases. And from there, you just go to James Tyler Kent, who was one of America's foremost homeopaths, who gave us the Materia Medica, the repertory, and philosophy books, and was sort of the forefather of what became known as constitutional homeopathy, that led through a bunch of different people, including what we do here. And that really, homeopathy is just based on a couple of principles: the law of similars, the minimum dose, the single remedy, and looking at the totality of symptoms. In that, when we look at symptoms, we try to find complete symptoms. By complete symptoms, it means you have the onset or the etiology, the location, sensation, modalities, and concomitants. So anytime somebody says, I have a migraine, well, when did you start getting it? Where is it? How does it start? What makes it better? What makes it worse? What does it feel like? And what else happens during the migraine? And the more of the symptoms you get like that, the more complete a symptom is, the more likely it is that you'll be able to find a homeopathic remedy. I think many people beginning homeopathy are so happy to find a symptom that they don't try to get the complete nature of it. So, yeah, ulcerative colitis, when did it start? What's the sensation you have in your gut? Where is it in your gut? It's lower down, it's higher up. When does it come on? What makes it better and worse? That sort of thing. Modalities is one of those complete symptoms. That's all the modifiers to a disease. And that symptoms are basically either general, meaning the I, which is the mind symptoms, and the I am cold, I am warm, like that. I have right-sided complaints, I have left-sided complaints, and all the particular symptoms. And then you basically give remedies, and remedies are given either in LM potencies, which I don't really talk much about, which is 1 part in 50,000. That's the dilution, or in the C potency, 1 in 100, or the decimal 1 in 10. And then we talk a lot about when to repeat and how to, all that we did in the follow-up lecture. And I think the remainder of what I wanted to talk about, broadly speaking, is the remedies. So I'm going to talk about a handful of remedies, and just in the last few minutes, I started sort of organizing it by systems. And I just did the 2 main systems, which is respiratory fever and digestive. And then after that, we'll do alphabetical. So these are sort of the remedies that anybody should know, or if you're going to teach like a course for your patients, or like a sort of first aid course or something like that. These are the remedies to know. Okay, let's just dive in. So aconite is a great remedy, often for fever states in acute situations, first stages of fever, first stages of inflammatory processes, and with a lot of excitement. So they've got a 103, 104 fever, there's not a lot of perspiration, there's not a lot of liquid around, and they're highly agitated, very restless. Many times the fever started with some kind of exposure to the cold or wind or something like that. Associated with fevers or separately, this is a great remedy for acute frights or panic attacks, feeling like you're about to die and a sensation that you're going to die. And in that state, having a claustrophobic, tight feeling. This is, naturopaths use this botanically as well, but when it's rarely do naturopaths use this because it's highly toxic, but when they use it in a full bottle, they might put 1 drop. Because if you take too much of aconite, it'll kill you. And the process is you'll have some numbness and tingling into your extremities, then you get kind of restless, anxious, then you get panicky, and then you get dead. So that idea of the restlessness and hyperness and agitation of fear, you'll see in aconite the patient. So if there's a kind of a shock, a kind of a car accident, or some frightful thing that they see, that they experience, the first remedy they might need is aconite in that sort of incredibly agitated state. So, sudden onset, intense reaction. That's the aconite. Allium cepa, this is the onion. It's a remedy for respiratory infections or allergies with the eyes getting really teary and it may be a little red, but the nose getting really red, the nose running and getting really red. Better open air, better cool air, worse warm air. Many times they'll develop a headache during this respiratory thing, whether it's an allergy or a cold. And many times the nose is just running like a faucet. It's also a remedy that you might use in amputation, when somebody had an amputation and they have phantom sensation. Antimonium tartaricum is a remedy that we use for coughs, acute coughs, where there's a lot of mucus in the lungs that they can't bring up. So you get this sort of weak cough with a lot of rattling in the chest. Their oxygenation is poor. They get blueness and discoloration in the face. They get cyanotic. So you see this acutely in the midst of whooping cough or really bad bronchitis. A few years ago, we had this as the main remedy during an epidemic of the flu some years ago. And you can see this acutely in drowning or near drowning episodes. And you can see this in chronic patients, old people, people that are about to die, or people that have horrible COPD and they just can't breathe well, and there's just all this junk in their chest that they just can't bring up. Worse, warm room, better cool air. Apis is a great remedy if in a lot of respects it's the first remedy to think of in a severe allergic reaction. And if you didn't know what else to give, that's the remedy to give. If somebody's sort of all of a sudden having edema, swelling for whatever reason, and it's like a drug effect, a drug reaction, or it's a bee sting or some animal sting or toxin, or it's you don't know why. They just ate something and all of a sudden they're blowing up. That's one of the first remedies to think of. So edema, swelling, hives with stinging, burning sensations. Worse, warmth, better, cool. They're typically thirstless. There might be some kidney disease that's leading to the swelling. And chronically speaking, there's irritability, there's jealousy, there's yeah. I think that's enough for Apis. Arsenicum album is a great remedy constitutionally, but acutely as well. In all instances, the main symptoms they have is restlessness, anxiety, fear of death, very similar to aconite, fear of being alone, fear of germs, fear of thieves, needing somebody to save them, needing to be around somebody to save them, going to the hospital, going to the emergency room, going to their parents' room. There will mostly be chilly people. They'll mostly be aggravated by cold and ameliorated by heat. And in that sense, they're a little bit different than aconite, because even if aconite is aggravated by cold originally, that's, they're exposed to the cold wind and they get this really high fever. Once the aconite is in an aconite state, they don't like to be hot. They like to cool down a little bit. Arsenicum in the acutes, whether it's a respiratory acute or digestive acutes, will be restless, will be thirsty, and they typically are thirsty for sips. Chilly. They typically have an aggravation at night, around midnight. When they have discharges, the discharges are acrid and destructive by nature. So if they have a runny nose, the runny nose makes the nose red. If they have a runny, tearing eyes, the eyes are red. If they have a diarrhea, the anus is raw. If they have a vaginitis, the labia is red and raw. As they become increasingly acute, they become increasingly weak. So you got this restlessness and weakness and fear. And that's sort of the picture. I think that's the main thing I wanted to say about that remedy. Baptisia, Baptisia, Baptisia is severe flus. Mostly it's infections and flus when it's in an acute state. Septic conditions with severe confusion and dullness. They just look like they're drunk and stoned and out of it, with potentially confusion of who they are and where they are. The keynote is, it feels like they're lying in bed and their body has been torn apart into different pieces. Their arm is over here and their leg is over there, and they're tossing about in bed because they're trying to put their body together again. The body aches, and the biggest clue for this remedy is during their state, their face is sort of purplish, not reddish, but sort of heading towards purplish, and the room stinks. The room stinks. It's so offensive. The smell is so offensive from the discharges and their breath and their wounds. Burrita carbonica is sometimes used in respiratory infections where the main complaint are tonsil swelling and glands swelling, as in mononucleosis or ear infections in kids. So lots of sort of respiratory symptoms, but the personality and the cognitive issues that come with burrita carb is what leads us to the remedy, where the person tends to be more childish, delayed development, lack of confidence, shy, timid, bashful kids, or adults that are just highly irresolute. So in this remedy, it's these sort of swollen glands on the one hand, and this sort of shyness and sort of shriveling up of the personality on the other hand. Next remedy is bryonia. Bryonia is a common remedy during respiratory tract infections with the main symptoms of the modalities leading into the prescription, where they're much aggravated by any kind of movement. There's sharp pains, intense pains, especially when they move the area. So if they're breathing, if they've got bronchitis or pneumonia or pleurisy, every time they breathe, every time they cough, it feels like a knife stabbing them. There's dryness of the mucous membranes. They're thirsty for a lot at one time. And with those sharp symptoms, you can also see that in injuries, and bryonia is a great remedy for injuries with sharp pains, worse, any kind of movement, better ice, better compression, better elevation. Better lying on the painful side. So it's the way to splint it or to immobilize the area. Causticum is a great remedy during respiratory tract infections for a cough. Causticum for a cough, where the cough is an intense, often a sort of a dry cough, where it's hard to bring up the junk. So they're coughing intensely, almost retching, and the mucus doesn't really come up. And they cough so intensely, they lose urine. It's a big remedy for urinary incontinence. It's also a remedy, and that's during bronchitis or even just a regular cough or even pneumonia. It's also a remedy for any kind of neurologic disorder where you start getting contractions of the tendons, contractions of the skin, tightening, arthritis with tightening of the tendons. The sort of unusual thing about this remedy is while most people tend to be worse from wet weather, worse from rain, causticum is actually better from wet weather. It's one of the remedies that will have hoarseness and laryngitis and frequent laryngitis. And personality-wise, it's people that are sort of rebels and idealists and can't tolerate injustice towards anybody. Chamomile. The most interesting thing about this remedy is the exquisite sensitivity. So for them, it's the modalities that leads us to the remedy. These people are intolerant to everything, overly sensitive to everything causes pain. And it's as if you have a raw tooth, which is a great remedy, chamomile, for teeth pain, or like you have severe, exquisite earache, which this is a great remedy for earaches. So sensitive to light, sensitive to sound, sensitive to noise, sensitive to touch. Nothing feels right. Everything hurts. And it's nearly a hysterical state. So in that state. You have a kid that says, "Mommy, mommy, mommy, pick me up, pick me up." And you pick them up, and it's like, "No, don't pick me up. Give me something." And they get this sort of peevish contrariness. Give me something to drink. No, I don't want this. I want something hot. No, I don't want that. This is too hot. I want it cold. And they're just sort of flipping around. And when you look at them, besides sort of seeing the pain on their face, one of the clues is one cheek will be red, one cheek will be pale, which is often the case if you have an earache in your left ear. The left cheek will be red and the right will be pale. Tendencies towards diarrhea, like spinach, the color and look of spinach. Screaming, shrieking. It's the noise of the kid on the airplane at 3 in the morning. That sort of screeching, piercing, annoying kind of noise. Drosera is the next remedy. The main remedy for this, the main uses for this is paroxysmal, violent, intense coughs. This is one of the remedies for whooping cough. You're coughing so much, you're getting nosebleeds from the cough. And it's like this barking. I don't have it in me right now, but I'll try anyway. It's like more of a bark, more of a gag, more of a retching, vomiting with the cough. The cough is worse drinking, worse heat, worse night, worse lying down. There's another remedy we'll talk about, spongia, that's better eating. So it's a nice differentiation. This is worse eating. Eupatorium perfoliatum is a great remedy for the flu. A flu where the main complaint is the body aches. It's not the cough, it's not the this and that, it's the body aches, and it feels like somebody's taking a knife and scraping the meat off of your body, off of the bones. It just feels like every bone hurts. Especially this area, the sort of the ilium, the lower spine and the hip area. It just feels like all of it is cracking and sore. Your back hurts, your eyes are sore. So it's the bone pain that gives us the prescription there. Euphrasia, eyebright, euphrasia is the remedy for hay fever, especially where the eyes are tearing and the eyes are really red and raw and where the nose is more bland. So it's sort of opposite to allium cepa, where the nose is red and the eyes are more bland. The next remedy is ferrum phosphoricum. But since we're doing ferrum phosphoricum, let me just talk about ferrum metallicum first. Ferrum metallicum is it's not in the sequence of respiratory illnesses, but just so you know about the remedy. It's a remedy for anemia. This is iron, ferrum metallicum. Anemia where the face is pale and flushes easily, and pale and flushes easily, where the complaints can come on either during anemia or during menopause, during heavy menstrual flows, people that have been chronic alcoholics, so they're not oxygenating properly and the face is getting sort of red. The keynotes that are sort of interesting are aggravated and intolerant to eggs. Eggs are disgusting to them. And better walking slowly in cool air. By which I mean they need some oxygen, but they don't have enough energy to go fast. They're sort of low energy people during this severe state. And so they feel better walking in open air. When we talk about this remedy in the chronic state, it's very, very different. But this is like on a sort of on the blush. This is a good way to describe the remedy. Even though chronically speaking, some of the most energetic people you will ever meet in the world need ferrum metallicum. It's a different story for another time. Ferrum phosphoricum, high fever, no particular reason. 103, 104 fever, and it's the early stage of an infection in a kind of a weak sort of individual. You might think about ferrum phosphoricum. Later on, it might wind up being pneumonia, or it might wind up being severe bronchitis, but really early on. High fever, no individuating symptoms this way or that way, bright red, the face can be pale or red, the lips get really red, and then you might have some kind of bleed with it, nosebleed, for example. Gelsemium, this is one of the remedies that was during the last flu epidemic, just this past year. Gelsemium, the fantastic remedy during the flu with weakness, and you're so weak, you're sort of shaking and trembling, and it's hard to keep your eyes open, and it's hard to think, and you're kind of droopy and dizzy and dull. Those are the sort of the D's around gelsemium. It feels like your head is full of cotton. You've got chills up and down the spine. Aside from that, there's anxiety as if you're going to be performing, stage fright. Stage fright is anticipatory anxiety. This is a big remedy for that. And it's many people will feel just before having a performance, they'll feel like they just got the flu, like all the energy got sucked out of them. That's the feeling that gelsemium has. With the sort of keynote where they feel like there's a lot of liquid in them, and because they feel like there's a lot of liquid in them, they're better urination. So the headache is better urination. And they're not necessarily thirsty because they have a lot of liquid in them. Better diarrhea. And they often will have diarrhea, loose stools during this state. Heparin sulf. The main thing about this remedy is it can be used for abscesses, it could be used for bronchitis and coughs. The main thing about this is just how sensitive they are to cold and to pain, but especially to cold. So when they come into your office, it's not unusual for them to be wearing a hoodie or to be wearing a hat and gloves and coat. And very often in the interview, they'll keep those things on. If you're doing house visits, when you go to their home, they're under the blankets and they're bundled up and they stay bundled up, and they're sort of and so worse from cold. In all the sort of cold coughs, anything leads to like sharp pains. So, for example, I have tonsillitis. When I swallow, it feels like a sharp pain, like a needle in my tonsils. When I drink cold water, it feels like a needle in my tonsils. Pimples, abscesses, and really bad abscesses, MRSA, and just really horrific, huge abscesses that anywhere in the body, including, Bartholin cysts, and where it hurts to even do this, to blow over the area because it moves the skin, it moves the hair. It's enough to create the pain. Irritable, nasty people. Calibicromicum, calibic. The main thing about this remedy is sinusitis with thick, ropey mucus. The rule of thumb used to be if you can blow the nose and pull it, and you can make a rope out of it, and you can lasso your patient with it. It's probably a calibic. So you pull. So it's this thick, ropey mucus, and if you pull the mucus quickly or fast, it might leave behind a denuded, a kind of a raw area in the nose. And that raw area will be sore and feel raw and be painful. And that kind of gives us the image of the kind of pains the calibic has, tiny area pains. So calibic is also a remedy for either chronic arthritis or acute arthritis. But when you ask them where is the pain in arthritis, they point to a very tiny specific area and they say, it's right here. It's this tiny little area right here, as opposed to pointing with their palm and saying this whole area. Kali carbonicum is a remedy for bronchitis, pneumonia, asthma. The lungs get affected very easily, whereas calibic, the sort of sinuses get affected easily. For calicarb, the chest gets affected easily, with sharp stitching pains, worse at night, worse around 2 to 4 in the morning, chilly people with a kind of a moralistic, judgmental, right and wrong kind of proper individuals. Sometimes there's swelling with Kali carbonicum, so there might be some edema somewhere in the face. The keynote is right here above the eye, like a bag above the eye, but you can have swelling of the ankles or swelling of the fingers. It's one of the remedies we use for horrible degenerative pathologies. The kidneys are being destroyed, the heart is being destroyed, and because of that, they're starting to have swellings. Rumex crispus. The main thing about Rumex crispus is a tiny little cough, not a huge cough. It's a tiny little cough, just like I'm doing, and it comes from the lower throat, upper chest, like around the throat pit and above, around the suprasternal notch and above. And the keynote of this remedy is when they have the cough. And the cough occurs whenever there's a change in temperature. So they're in bed, they pull the covers off, they start coughing. They're in the house, they open the door, change the temperature, they start coughing. And it could be in either direction. They're undressing and they start to cough. Sabadia is primarily for hay fever. Could be other respiratory tract infections, but primarily hay fever, where the key symptom is sneezing. And I don't mean sneezing like this. I mean like just a attack, a large attack with intense sneezing, like you're gonna become dizzy from the intensity of the sneezing. Sensitive to cold air and chilly. That's the main thing about Sabadia. Sanguinaria, or bloodroot sanguinaria, they can have these intense coughs, so I'm mentioning it here, though the primary reason you give it is headaches and migraines, with the keynote that the headache is on the right side, and the actual keynote is it starts in either the shoulder or the trapezius and works its way up the right side, and it kind of ends up somewhere around the right forehead, or bursitis, right-sided bursitis, shoulder bursitis associated with the headache, where as the headache becomes more and more severe, they throw up, and when they vomit, it makes the headache better. Spongia, the main reason you use this is in bronchitis and in really bad coughs, where I think what people want to know is that it's a dry cough with a harsh, barking, intense cough. But the actual keynote, and better eating, better drinking, but the actual keynote is this. The cough comes from the suprasternal notch, which is right here, the throat pit, and in every instance, 100% of the time, somebody needs spongia. When you ask them to look at the ceiling, to tilt their head up, to move the chin up towards the ceiling, they'll get into a coughing fit. Each and every time. If they do not do that, they do not need spongia. And lastly, the remedy tuberculinum. This is more for chronic asthma and repeated bronchitis. This is a remedy you give more in a chronic state. It's people that are sort of hyper, restless, getting sick a lot in cold, wet weather, a tendency towards grinding teeth, towards chilling, towards sweating a lot, sweating in their sleep, bedwetting, teeth grinding, with food allergies like milk allergies, even though they crave milk.
So spongia? No.
Tuberculinum. Desiring fat, desiring smoked meats, desiring delicacies, restless people, restless kids, hyper kids, and sometimes nasty kids with fear of or allergic to cats. So those are sort of the allergic to cats. And these are sort of the just on first blush, the remedies for that are respiratory based, remedies to think about when somebody has a respiratory complaint. In terms of digestive stuff, digestive remedies, there's Aeschylus, which is hemorrhoids with sharp stitching pains, especially hemorrhoids that lead to pain in the sacroiliac joint. Aethusa, Aethusa, Aethusa. The main reason to give this is babies that have projectile vomiting. They drink milk and they vomit intensely, and then they're wiped afterwards. And you look at the baby, and they're sort of thin and shriveled and sleeping. They're so exhausted from this vomiting. Aloe, the main reason to give this is people that have involuntary stool. So they soil their pants. This could be acutely, like acute diarrhea, where they've got to like run out of bed at 5 a.m. and you know they don't quite make it to the bathroom. But it's also just people that may have some sort of chronic problem, like Crohn's disease or colitis, and they just jelly just comes out of their rectum, and a lot of times there's gas associated with it. There's a lot of rumbling and gas. So, am I about to pass gas? Am I about to get past gas? Am I about to? Oh dear, it's actually stool that comes out like that. Alumina is primarily for chronic complaints and for dementia, for Alzheimer's, for slowing down life processes. Going along with that, you've got severe, horrific constipation. Constipation where you have to use some sort of manual stimulation to get the stool out.
So this is for somebody who already has Alzheimer's and has constipation, not just for Alzheimer's. Is that
Right. Dryness is the big keynote. Dryness of the face, not sweating a lot, and the dryness of the face, there's sort of a cobweb sensation on the face, cracking skin, and just sort of, and even paralysis and dementia with it, dementia. We talk a lot about these remedies constitutionally, and we will talk about we have some of these remedies we've talked in depth about, like apis, for example. Some of these we'll talk about, like alumina, but yeah. Anacardium, the main symptoms around this is cruel people, hard-hearted people, people that might be cursing, and people that don't necessarily follow the rules of society, people that lack morality, people that feel like they're stuck between good and evil and not knowing which one they should follow. Also people with like poor confidence. All their symptoms are better from eating. All their symptoms are worse from fasting. And digestively, in terms of the stool, the stool is soft to start with, and it just gets harder and harder as it goes along, which is sort of unusual. Again, these are sort of caricatures when we talk about anacardium fully or antimonium tartaricum fully. You see like a fuller picture, but this is sort of the keynotes of the remedy. Antimonium crudum, obstinate kids with digestive complaints that crave pickles, crave cucumbers, crave sour things, and the big keynote is the tongue has a white coating, like a milk coating. Irritable kids. Hemimellus is another remedy for hemorrhoids, but for varicosities in general that bruise and bleed easily. And veratrum album for intense discharges and with coldness, weakness, collapse, with diarrhea, with vomiting, with intense sweating, with horrible menstrual pains and discharges. Just profuse discharges from every orifice that's possible. And with the discharges becoming incredibly weak and cold. Also people that are in a more chronic sense have hyperactivity, haughtiness, delusional that they're Christ or something like that. All right, those are sort of more digestive remedies, and then just the rest of these are sort of in alphabetical order. Agaricus, the main reason to use this is neurologic diseases that have twitching and spasms with it. Agaricus, twitching, tics, and at the same time, people that have anxiety attacks and panic attacks. Argentum nitricum, Argentum nitricum, impulsive, anticipatory anxiety that leads to diarrhea, test anxiety that leads to diarrhea. But whereas gilcinium, in the test anxiety and the diarrhea, they get kind of weak and sort of, oh my God, I can't keep my head up, I can't keep my fingers going. Argentum nitricum gets all sort of hyper, and they get so excited, they get sort of, and the diarrhea comes out, and it's like, oh my God, I got diarrhea, and I got a test, and I got diarrhea. It's a different expression. Warm-blooded, Argentum nitricum, worse warmth. Arnica, the main thing about arnica is the trauma, concussions, where they say they're okay, with aching pain, worse touch, nosebleeds while washing the face, and yeah, I mean, there's a lot to say about all these remedies. There's a lot to say about arnica, but the sort of bruised sensations.
If somebody has a trauma and you hear about it 2 days later, is it too late?
And with arnica, you can give it immediately, and you can give it 50 years later if they stay in an arnica state, because you can stay in an arnica state, indefinitely. Aurum metallicum, the main remedy for suicidal ideation where somebody really wants to kill themselves and they see suicide as not just an option, but a positive, viable option. Hey, no matter how bad things get, I can always kill myself. And they're sort of happy at that idea. That is the Orm state. Very depressed people, very, very harsh people, very black and white kind of people, serious, difficult people, with grief, with loss. The loss is personal, like your own personal health, like I'm gonna, I have cancer, I'm gonna die from cancer, why don't I kill myself? To loss, my husband has cancer, they just died, my husband, my mother has dementia, I should just die. To financial loss, my business just this and that, I should just kill myself.
And do they actually
and they do it. Very, very, an Orm state is a lethal state. It is, if you take 100 people that kill themselves, I mean, in a quick way, I don't mean the slow drinking and, but somebody that actually took a gun to their head, even though we have 5,000 different homeopathic remedies, a substantial number of people that kill themselves would have been in an Orm state. So it's a very important remedy to know. Religious people, high moral, perfectionistic people, and also people that have sort of destructive behaviors in their life, gambling, alcohol, and so on, or destructive processes in their body, like the bones are breaking down in one way or another. Berberis, the main thing about this remedy is kidney stone, kidney pain, where the pain travels down the ureter, radiates down the ureter towards the bladder, and there's a sort of a bubbling sensation in the back, in the kidney region. Borax, the main thing about this remedy is canker sores or thrush or ulcers in the mouth that are very sensitive to pH changes, to acid, vinegar and lemon and like that. And in general, they tend to be sensitive people, sensitive to noise, sensitive to light. And the keynote is aggravation from downward movement. If they're on a swing or if you put the baby down, the process of putting them down, the baby wakes up screaming. Nearly done. Cactus, the main reason for this is angina or heart pain, but it could also be dysmenorrhea, uterine pain, where it feels like a wire is wrapped around, tightening and tightening. So it's not like a thick compression or pain, it's a thin compression, like just a thin wire squeezing. A lot of women that have menstrual cramps, if they're describing cramp, they describe like a whole area, a wide area, but this is a very narrow band. Calcarea carbonica, obstinate, overwhelmed, tasked people, workaholic people, working too much kind of people, anxious about their health, anxious about their family, anxious about their job, anxious that people can see the anxiety on their face, fear of heights, fear of high places. Yep. They tend to be overweight. Swollen glands, repeated respiratory tract infections, sweating, perspiration during regular life, perspiration in their sleep, swollen legs, swellings in general, the tendencies towards constipation, any kind of bone thing you can think of, everything from the bones are babies where the skull is not closing properly or closed too fast. They've got spina bifida. They've got bones that break easily. They've got osteogenesis imperfecta, the osteopenia, osteoporosis, infections of the bones. Anything you can think of the bones, calcarea can have. Likewise with any of the arthritis, likewise any respiratory complaint. Calcarea phosphorica, discontented people, unhappy people, children with growing pains, children with chronic stomach complaints, craving meat, craving smoked meats, craving salt, all kinds of bone problems in growing children. And sometimes when the bones are broken and they're not healing well, this is a remedy to give. Calendula. Calendula, mostly we use it as a tincture, but you can use it in potency as well if there's an injury, like a wound, like a bite or infection, and then it's not healing right and getting an infection, like an infection in the skin. You can take calendula as an in potency. Cantharis is a common bladder infection remedy. Common remedy for cystitis. But it's a severe cystitis. Severe cystitis, sudden onset, intense symptoms, intense tenesmus where it's urging to urinate and you're going intensely, you're going quickly and just drops come out and they're hot, they're burning. In fact, this is a great remedy for burns as well. Carbo-veg, these are people that pass out. They faint easily. They don't have enough oxygen. The skin gets cold and clammy and kind of bluish, and they pass out. This is also for older people with COPD, where they're in your office and they're burping a lot, and they have this sort of shortness of breath, and they're kind of pleasant and shortness of breath and burping and about to pass out of cold sweat. Acutely, this is also a great remedy for giardia. For regular people, health nuts. They go camping, they drink water, they get giardia, and they might go into a carbo-veg state where they're belching and passing gas in both directions. And importantly, when they're belching, they feel better. They get a kind of a relief from the belching, but they're getting weaker and weaker and weaker very quickly. Carcinosin, a family history of cancer, very responsible people, sweet people. Physically, there's a blue, the whites of the eyes are blue, they have a bluish tinge, and they have cafe au lait spots, which are just these areas in the skin that are sort of larger, highly tanned areas. They like to travel, they like music, they like dance, they like thunderstorms, they like all kinds of sensual experiences. Colophilum. The main reason to give this is during labor, where the os is closed and won't open up, and the labor is just not progressing at all. China or cinchona, this is the first remedy that Hahnemann proved. The main thing for this remedy is loss of fluids, ailments from loss of fluids. So you bled a lot, or you nursed a lot, or something like that. There's some kind of periodicity associated with it, worse at certain time of the day. The keynote is worse touch, better pressure. And there's a fair amount of bloating and distending and passing gas, but the passing gas does not help. They're bloated, they pass gas, they're still bloated. It's a great remedy for any kind of liver disease and gallbladder disease, any kind you can think of. It's a great remedy for malaria and fevered states. Sena, irritable children, grinding teeth, picking at their nose. This is a remedy for kids with worms, people with worms, grinding teeth in their sleep, and just there's like the nervous system is irritated, so they themselves are irritable, and they're like picking at their teeth and picking at their nose and picking and grinding and unsettled, irritable children, unpleasant children, really. And sometimes you'll give Sena and the worms will go away, but you usually do, if you're going to give Sena, if they have worms, do everything you can do, everything you know to do to remove worms.
Is that just pinworms or usually
all worms? Cocculus indica, vertigo, motion sickness, especially from loss of sleep and from taking care of somebody. We talked about cocculus a lot. We talked about the cycle of it and what it's like chronically and so on, but it's acutely, that's the main thing to know. Colocynthis is a great remedy for cramps. Severe cramps that anybody might have, either acutely or chronically. Cramps. Whether the cramps are menstrual cramps or digestive cramps or any kind of cramp that doubles you up, any kind of cramp that makes you push on the area. So let's say the cramp is in your abdomen to lower pelvis. So you're bending forward, you're pushing on the area, you're putting heat on the area. You might be sort of closed, sort of shut down, and maybe even restless from this intense cramping pain. Yeah.
You can do the pancreatitis.
Conium maculatum. The main thing about this remedy is cancers and tumors that are hard lumps, glands in general that are hard lumps, especially if there's been some kind of injury. So breast cancer after sort of injury to the breast, or just a hardening tumor, which goes along with their personality in that they often have this sort of hardened aspect to them.
What was that one called?
Conium maculatum. As well, this remedy is used for paralysis, gradual ascending paralysis. So it's it starts in the feet, it goes up to the knees, it goes up to the hips, it kind of works its way up.
Yeah.
Guillain-Barré, for example. Breast tenderness. Yeah. Cuprum maculatum is a remedy for cramps and spasms and epilepsy. But it's also a remedy for cramping from different situations. So, for example, they have whooping cough, and they're coughing so intensely, so spasmodically that their fingers are cramping, their throat, their neck is cramping, their calves are cramping.
Human copper metallicum. That's what
Yep.
I like.
Yeah, Cuprum metallicum.
Seizures too, is that what you said?
Epilepsy. It's a great remedy for epilepsy. With the keynote of, well, two keynotes. The keynote number one, the thumbs go into the hand, and keynote number two is a Jacksonian march. So Cuprum metallicum. So Jacksonian march, the epilepsy starts in the hand, then it's the arm, then the shoulder, then the whole, and then the whole individual. Diascorea is cramps in the abdomen, but almost in most instances, people that have cramps go like this. They go forward. But diascorea, unusually, in the cramps, they go backwards. That's really the main important thing. Dulcamara, the main keynote around this remedy is the modality worse during the change of weather. So it's hot days, cold nights, or cold days, warm, like those sort of opposite days. When the weather changes a lot, this remedy gets sick. And the main sick they get is hives and lung stuff like asthmas and bronchitis. And especially if you have hives, then the hives go away and they get asthma, and the asthma goes away and they get hives, and just that back and forth, that's good for Dulcamara.
How do you spell it?
So Dulcamara is Dulcamara. Equisetum. The only thing about this remedy is bedwetting for no particular reason, just lots of bedwetting. Equisetum is Equisetum. Equisetum.
For children?
Mostly children, yep. Glonoin is nitroglycerin. The main thing about this remedy, very similar to belladonna, congested face, full face, throbbing red face, surging blood pressure, just lots of heat in the individual, like you might see in sunstroke or heat stroke. or like they're about to have a stroke, women with hot flashes, and during this sort of weird blood pressure congested thing, and because of that, they get kind of dizzy and they get kind of confused of where they are. Graphites. The main thing for this remedy is keloids, scars and keloids, or eczema that's oozing thick, honey-colored, honey-textured discharge from their eczema, or vaginitis with the same sort of characteristics. Thick skin, cracked skin, the fissures on the fingertips or the nipples or the anus or here where the ears are, or the nose, at the edge of the nose or the edges of the eyes. Thick kind of people. Hyoscyamus, shameless people that expose themselves during strokes or fevers, jealous people, suspicious people. Hypericum.
What was it, the name?
That was hyoscyamus. Hypericum, injuries to the nerves or the spinal cord, injuries to the sort of the ends of the nerves, so fingertips and so you're hammering the fingertips, or you're young and stupid and decide to lick the ice in the freezer, or you decide to lick the frozen pole outside in the wintertime, and you lick it and your tongue gets stuck and you've got to rip it off. Puncture wounds or falling on your coccyx, falling on your tailbone. Any of these sorts of sharp shooting pains from these injuries to the nerves.
And they go up.
Sharp shooting pains going upward, going towards the chest. So if it's in the hands, it might go down.
Not a sciatica going down.
Right. Ignatia, grief, sighing, hysterical, averse consolation, moods that are flipping around this way and that way. Just grief, tension, tight trapezius, sense of a lump in the throat. Iodum, which is iodine, is going to have like all the symptoms of hyperthyroidism. So really restless or losing weight or being really hot, needing to eat a lot, that sort of thing. Ipecac, this is for nausea, intense nausea, even after throwing up. So you're nauseous, you're sick, you throw up, you're still nauseous. It's a remedy that can have a lot of bleeding. And the interesting thing with the bleeding or with the nausea or with the vomiting is when you look at the tongue looks perfect. It looks clear. It looks clean. which is important because a lot of times when people get sick digestively and you look at the tongue, it kind of has like this yellow moss or this white coating, but with ipecac, it's just clean. Creosotum, vomiting. Well, it could be for like vaginitis that's acrid and sort of really acrid, but the most common thing to use it for is, and also teeth that are crumbling, like teeth in children that are crumbling. But the most common thing to use it for is vomiting. And the interesting thing about the vomiting is you're vomiting 4 or 5 or 6 hours after you ate, and you look at what you vomited, and it looks exactly like what you ate. It does not look digested in the slightest, which is bizarre because the acid should have done something with it. Lachesis, forceful, passionate, intense, chatty, talky, suspicious, domineering sorts of people with any kind of complaint, though usually there's some sort of vascular aspect to it. There's some sort of pressure in the story, some sort of something has to get out part in the story. Left-sided complaints in general, menstrual complaints of various sorts, though primarily they're worse before the period or not having a period, better having a discharge. So worse before they get the period the first time, worse before every period, worse from birth control pill, worse from menopause, worse during pregnancy. Anytime the period is like messed around with, they can have a problem. Hot-blooded in general, usually. Suspicious. Competitive. Yeah. Ledum, the remedy ledum, for first aid and bites and cuts and puncture wounds where the area feels cold to the touch and it feels better from putting cold on it. It's also a remedy for arthritis that feels better cold. So I have arthritis in my elbow. I have to put it in ice cold water to make it feel better.
Can that be given much later than first aid?
This is ledum is used the first aid for the cuts, and it's used chronically for, somebody could be in a ledum state for 20, 40 years.
Is it cold when you touch it?
It's cold to touch. So you touch it, and it feels cold, and then you put it in. You'd think that it feels cold to touch. You'd want to put it in something warm, but in fact, they want to put it in something cold. It's not the only. There's other times to use this remedy. For example, all these remedies. As I say, this is like a sort of a caricature first blush on these. They all have like a long use. For example, you could have stepped on something and your foot gets really, really swollen, or you could have gout, and you're in the gout, your toe is, 3, 4, 5 times the size that it usually is, and it might feel hot to the touch. Nevertheless, it's much, much better putting it in ice cold something.
So even though.
Yeah.
Okay.
Lycopodium. Aggravated from 4 to 8. Right-sided complaints or right going to the left. digestive complaints with gas and bloating and swelling and burping and constipation, and low self-confidence that they try to sort of mitigate by being bossy and domineering. Magnesium phosphoricum, or MAG-Phos, is another remedy for menstrual cramps and abdominal pains that are better heat and better from pressure, like colocynth. But if it matters, the personality is very different in that the personality in MAG-Phos is most easily confused with pulsatilla. Weepy, sweet, help me, that kind of person. Metarhinum is a remedy for extreme states, extreme personalities, and bouncing around from extreme personalities. High sex drive, inflammatory processes of various sorts, sexually transmitted diseases, better being at the sea, better swimming in the ocean, craving ice cold drinks, lemons, sour things, oranges, alcohol, drugs. Mercurius, the main keynotes around this remedy is sweating, salivation, trembling, destructive discharges, destructive processes, lots of ulcers.
This is Mercurius vibe.
Mercurius vivus, yeah, or which is the same, practically speaking, as Mercurius solibus. Syphilitic remedy, worse at night. The tongue takes the imprint of the teeth, what's called a scallop tongue. So it just looks like the edges of the tongue are not smooth. Lots of respiratory tract infections and glands and tonsils and all sorts of destruction, all sorts of cancers, and the body kind of falls apart. As a personality, there's different parts of them as well. Impulsive or OCD, outgoing or introverted, just sort of bouncing around personality-wise. It's a common remedy for ear infections. Nature muriaticum. Introverted people, perfectionistic people that find it hard to share their emotions with others, and so they experience sadness alone, they experience grief alone, just them and their music that's emotional and their movies that are emotional, but not other people. Dogs, sharing their emotions with their dogs in their diary and stuff. But it's hard for them to actually open up. A tendency towards headaches, tendency towards skin problems, eczema, cracked skin. They're aggravated by the sun. They're tend to be warm-blooded, thirsty for cold drinks. And, yeah. Natrum phosphoricum, this is sort of a combination of phosphorus and nature mirror. The main thing about this remedy is yellow tongue, especially the back of the tongue is yellow, and low back pain, weakness in the back, and low backache, desire for fried eggs, and in Chinese medicine, what they call a weak kidney qi or something, they have nocturnal emissions. The men just lose semen at night. Natrum sulfuricum. The main thing about this remedy, it's sort of a combination of nature mirror and sulfur. The main thing about this remedy is head injuries with a personality change, suicidal dispositions,
I'm sorry, which
natrum sulfuricum, suicidal dispositions, asthma in wet weather, in humid weather, aggravation at 4 in the morning, and diabetes after grief. Sensitive people, diabetes after grief. Cheerful after a stool. And it has several symptoms of metarinom, so there's like all these sort of sexually transmitted diseases. Nitric acid, chilly people, negative people, negative people, negative people. Nothing is ever going to go right, and I'm going to hold you personally responsible for it. Stitching pains, sharp pains, ulcers with sharp pains, tonsil sharp pains, eczema sharp pains, whatever the complaint is, sharp pains. And that's exactly what it's like. Every time you try to do something, they take offense, and it's like it hurts them, and they will never forgive you, ever, ever.
So
They,
something like this comes into your office,
they crave strong foods, strong smelling foods, and strong cheeses and mustards, and just foul smelling, tasting things. Nux mosciata, narcolepsy, where they just fall asleep where they don't mean to while they're driving, or spacey people, or this is a fantastic remedy. Nobody says this, but this is probably the best remedy for post-surgery. So it's not really the surgery, it's the anesthesia. Post-anesthesia, sort of being out of it. And like a lot of people will be out of it that day. But if you're out of it for days and you just can't regain your energy, and you're sort of sleepy and dopey, and you just can't wake up, Nux mosciata could be the remedy for you. And as a keynote, what it has with that is dryness of the mouth with a sensation, with a thing where your mouth is so dry, the tongue sticks to the roof of the upper palate. Nearly there. Nux vomica, irritable, precise, impatient, irritable, no nonsense, get this done, ambitious, get it done right now, nux vomica, chilly people with sensitivity to noise and to light and to touch and to smells. Wants to but can't. Wants to vomit but can't. Wants to have a bowel movement but can't. Just sort of crampiness for a lot of different reasons, whether it's with cystitis or with irritable bowel syndrome, and desiring stimulants, and can't waking up, either can't sleep or waking up at 3 or 4 in the morning. Opium. 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 People in a coma after a stroke or after a head injury, after a car accident, they're in a stroke. They're in a coma. They can't wake up. People that have sleep apnea, where they can't wake up and they're sort of snoring and their breathing is irregular. People that are going to die in the near future and they have this sort of irregular breathing where they're breathing like this. Cheyne-Stokes breathing. Spacey people, people with severe constipation where there's no urge. And people that should feel pain in certain situations where they don't. So you're treating a kid and the kid hits his head. It just keeps on going, doesn't feel it. So that's sort of enough for and constipation, no urge. Petroleum. The main thing about this remedy is skin cracks like on the fingertips, especially in the wintertime. Better, it goes away in the summer. Eczema or just dryness of the skin where the skin cracks. Chilly people, slightly irritable people.
Did you say fingertips?
Fingertips. Phosphoric acid, ailments from grief with apathy, indifference, sort of staring at the wall, not moving, not doing anything, not able to respond emotionally, with incredible weakness and adrenal fatigue, exhaustion, not being able to weep anymore. I have, like a woman told me, I have wept so much. Her husband died. I have wept so much. There's nothing left to cry. There's nothing left. Phosphorus. All kinds of discharges, diarrhea, vomiting, bleeding, and therefore you want to replace it. So there's a high thirst especially for cold drinks and ice cold drinks. There's a amelioration by comfort, by people and massage and Reiki and polarity and Bowen technique and just amelioration by comfort by other people putting any kind of energy into you. Anxious, fear of death, fear of all kinds of fears, very impressionable kinds of people, very nice people. Craving sweets, craving spicy, craving cold drinks, craving ice cream. Palpitations that are worse lying on the left side. Lots of things worse lying on the left side, so they have to lie on the right side. Phytolacca, the remedy phytolacca. Swollen glands, mastitis. It's a big remedy for mastitis with the pains radiating down the body and down the chest, breast abscesses, swollen glands and swollen tonsils. Platina, the main thing about platina is sexually overly stimulated, hypersexual sex, crazy sex drive, haughtiness, arrogance, numbness in the body somewhere. Feeling very, very special. Special, feeling very, very special. Plumbum, neuralgic conditions, any kinds of nerve disease that leads to paralysis in the area. Everything from Parkinson's disease to post-stroke, just sort of closing up the person's, their life is sort of shutting down, closing up with this heart paralysis, exemplified by a pain in the navel, pulling backwards. It feels like a rope from your belly button pulling backwards. It's the same thing as their overall body. Their whole body is sort of closing up shop. Podophyllum. The main thing about this remedy is sudden, severe, explosive, stupendous diarrhea. It's you know these Turkish toilets, the sort of the hole in the ground does not work well for podophyllum because it like just spreads everywhere.
So the plane
Just-
they had to turn around and take back to Germany or Rome yesterday because somebody went in the bathroom and it was so vile that they turned the plane around. That would be podophyllum.
Like that. Serenum. Chilly people, so chilly that they're wearing their hats and gloves and like in the summertime, these are not people who are going to be walking around in open sandals. Chilly people that keep things like hoarders, just keeping stuff. People that have all kinds of skin rashes, skin eruptions that are smelly, and in general, these people smell. They look very much like somebody that needs sulfur, except they're chilly. Hopeless people knowing that something bad is going to happen. So anxiety is a big feature of the remedy. So Sorinum, Psorinum. Pulsatilla, sweet, mild, pleasant people wanting comfort, wanting consolation, thirstless people, warm people that need cool, fresh air, feeling like they're going to pass out in those library stacks, liking ice cream and sweet, puffy things, and not liking heavy animal product foods. Ear infections and bronchitis and sore throats and like that. Easily malleable people, sweet people. pyrogen, this is an infection usually. It could be an acute like flu type thing, but often it's an infection. With the big keynote is that the room smells horrible, just like in baptisia. And the second big keynote is hot. The higher the typically your pulse is related to your temperature, and every time your temperature goes up 1 degree, your pulse goes up another 10 points. But so if your temperature is 98.6 and your heart rate is 70, if your temperature went up to 99.6, your heart rate should be 80, like that. But with pyrogen, that breaks. So you can have a high fever with normal pulse, or you can have the pulse speeding up and the temperature being normal. So it like flips back and forth. Rust toxicodendron. The modalities are really, the sensation modalities are the important things here. Stiff, worse first motion, better continued motion, worse overexertion, better heat, worse cold. This is true in their arthritis. This is true in their sprained ankle. This is true in their this is true in their laryngitis from speaking too much. Worse first thing in the morning, better the more they talk. Worse at night, the laryngitis kicks in again. Worse ice cold drinks, better tea, like that. So they also have all kinds of skin problems, with the skin problems sort of often coalescing and becoming bumps, with sort of like at the tip of the bump, another little bump on top of that. So it kind of looks like a pimple on top of a pimple. Ruta is periosteal pain or periosteal injuries, injuries to the tendons. Yeah, that's really the connective tissue areas from overuse and not wanting to use it. Sarsaparilla, cystitis with pain at the end. Sarsaparilla, cystitis with pain at the close of urination. Sepia, hormonal shutdown, total and complete hormonal shutdown. This can happen from a miscarriage or from an abortion or from getting pregnant, from birth control pill, from labor, where you just, nothing matters anymore. You lose your sex drive, you lose your loves and your hates, everything sort of flattens out. Chilly people, just like your emotions sort of flatten out, everything kind of gives way. So your pelvic floor drops, and you start getting hemorrhoids and constipation, varicose veins, and your bladder drops, and you got stress incontinence, and everything just sort of sags. Craving vinegar, craving sour. And to feel better, they do something, some kind of activity, some kind of high-intensity movement, like high exercise, aerobics, just to feel their emotions again. Infertility, amenorrhea, dysmenorrhea. Silica. Refined people sensitive people, precise people, weak people. They fear big things. They fear tiny little things. They fear people bossing them around, but they fear little glass shards on the floor, needles being left someplace. Stage fright because they don't have enough energy. Chilly people needing comfort, needing clothes, needing extra protection because they don't have enough. Babies with failure to thrive. 90-year-old people with feeling frail and fragile. Failure to thrive in babies, intolerant to this formula and breast milk and just trying to hit it right is very difficult. Swollen glands, hard tonsils, hard glands, sweating a lot, infections in the tear ducts and the eyes, abscesses, bashful stool, constipation with bashful stool, nearly there.
There's a lot of skin problems.
Lots of skin problems. It's a big remedy. Big remedy. Spigelia, sharp shooting, stitching pains, especially right here. Spigelia, left side, this would be sanguinaria, this would be spigelia. This would be calibic, this would be spigelia. Left-sided and sharp pains in the head, sharp pains around the heart. Stannum it's a remedy primarily for respiratory problem where you feel like your chest is hollow. Stannum, S-T-N-N-U-M, stannum. The chest is hollow and empty and weak, and this is because you have pneumonia, or you have COPD, or you have lung cancer, you have adrenal exhaustion, you have something where you're just so depleted you can't speak. You're empty inside. Staphysagria. The main thing about staphysagria is suppressed emotions, especially suppressed anger. Somebody does something to you, and it makes you so mad, but instead of blowing up, you sort of swallow it. It's a remedy for what they used to call honeymoon cystitis, where you're having bladder infection after sex. Inability to confront somebody. Stramonium, people that have like these night terrors, people that have fear of evil, dark, scary things and animals and ghosts, people that might be violent, and during the violence they might be extremely strong. Sulfur, very warm-blooded, burning pains, discharges from anywhere that are irritating and smelly and destroy the skin, redness in the different parts of the body. The tendency is towards diarrhea. Loud, brash people, argumentative people, theorizing, messy people, all kinds of skin problems, especially itchy, getting infected, craving sweets and spicy and fat and meats and cold drinks and hating eggs. Just 3 more remedies. Symphytum, when you broke a bone and it's not healing, it's the non-union. Periosteal pain and trauma to the eye.
What was the remedy?
Symphytum. Symphytum.
It's this way again.
Syphilinum. Syphilinum, people with obsessive compulsive disorder, superstitious people, checking, rechecking. Did they really shut off the stove? Did they really lock the door? Chief complaints are mostly worse at night. Any kind of congenital disease, any kind of birth defect, and destructive behaviors like alcoholism, gambling, and such. Tobacco, motion sickness and seasickness, where you feel like you're going to throw up. Well, you are going to throw up. Where your face gets all sweaty, you yourself get sweaty and warm, and the main thing that helps is if you could just lift your shirt and let cool air hit your chest, your abdomen. Tarantula hispanica, very restless people. Very, very restless people. Very restless people. Sensitive to colors and lights and liking to move and liking music and, yeah. 2 more remedies. Thuya, warts of various sorts. Chilly people, worse from cold and worse from wet. Left-sided complaints, ailments from vaccinations, and a sensation like something is alive in your stomach, something is alive in your abdomen, something is moving there. And the last remedy is urtica urens. The main remedy for the main uses are hives and allergic reactions to any sorts of things where sort of there's itchy crawling sensations and burning sensations and stinging sensations where they feel like they're getting worse cold baths. And that's it. I think that's all of it. But honestly, this is what you tell people to pass tests, and this is what you tell people to sort of get a first sort of glimpse at these remedies,